My late father was a GP and my mother is a retired nurse, worked as a ward sister at Great Ormond Street Children's Hospital. Although I grew up in a medical setting, living above my dad's GP surgery in the Fens, it didn't give me immunity to ill health, even though I had my own personal doctor and nurse on hand. I've had to access mental health services from a young age, and after my father's death in January 98, I ended up addicted to heroin for over a decade as a way of coping with my loss and my continuing mental health needs. Through much determination, I became drug-free in August 2007 and went on to peer mentor others with a local drugs charity. However, in December 2008, I was involved in a car crash, causing me a lumbar spine injury and therefore mobility problems. I was housebound for 3 years and went on to reach 33 stone, and my life was extremely miserable, as I'm sure you can imagine. All my hard work felt lost, and I felt extremely sorry for myself too. Eventually, and after years of pleading, I qualified for a full gastric bypass, which saved my life. I've now lost 12 stone and saved the NHS a lot of money in long-term care. This operation only came about due to me being diagnosed with sleep apnea. Sleep apnea is when you stop breathing in your sleep. This scenario underscores the complications of limiting entitlement, as without sleep apnea I would not qualify for my operation, and that raises the question of me having it long before and the benefits to myself and the NHS budget. My mental health didn't seem to come into consideration apart from an assessment just to qualify, and the focus was on my physical health. I had been discharged from mental health services just 6 months before my operation, even though they knew it was planned. Since having the operation, I've struggled with my mental health, but I'm one of the lucky ones who can just about fund a private therapist. My mental health has impacted on my physical health over the years, and that was the biggest underlying cause of my extreme weight gain. In fact, when I finally found out that I qualified for this operation, I felt hope as I had another chance at life. So much so, I lost 4 stone before the operation on the milk-only liver shrinkage diet. Goes without saying, I've never drunk a glass of milk since. In my experience and in the group, it is that physical health, mental health and social care is not joined up. If you have a mental health condition, as most people do with a long-term condition, then it only exacerbates your situation. I've heard of experiences where the mental health team and social care team were fighting over which pot the money comes out of. Surely this must change. As patients, and indeed carers, we don't care which pot the money comes out from. We just want the care we rightly deserve and our needs met without being pigeonholed into physical health, social care or mental health. We want a seamless service that sees us as one human being with multiple needs, not separate, isolated needs. I understand that one funding stream is not the only answer, but it's an important step in the right direction if we truly want a seamless service that meets our multiple needs. I also understand that with an ageing population that's growing exponentially larger, and with the current austerity measures, that the money has to come from somewhere. Not everything can be covered by productivity savings from an integrated service. As a country, we must take our collective heads out the sand and start making some hard decisions. We also need to inform the wider public who still believe social care is free at the point of use. Only then can we start making real changes to make things happen. I hope the report starts this debate and that it gets us all asking those hard questions that the report raises. I'm extremely proud to be working with the Commission and the King's Fund. The Commission did a great job canvassing opinion through stakeholder events around the country, through social media and with a call for evidence. The Expert by Experience group has been a small step but a giant leap for patient and public involvement. I've been humbled to be part of this group of 10 experts and know we have all had an impact on the thinking of the Commission and have all influenced the report by putting real lives and experiences at the table with the Commissioners. On a report like this that focuses heavily on economics and structures, it's very easy to forget about the real lives that will be affected by the ideas put forward in the report. However, that's just a small part of what the group has achieved so far. Not only have we reminded the Commission of what it's like to be on the receiving end of a system that is far from joined up, but we have gone on to read the report and give our thoughts and questions on how these proposed changes will affect patients and in some cases their carers. We've questioned the Commissioner's thinking and even tried to come up with our own solutions, as we know that's the hard bit. For me, as important as the report is, I'm aware that as the first expert by experience group working with the Commission and the King's Fund, we are treading new ground and laying the foundation for others to build on. This whole process has been extremely challenging, and although not perfect, we have made significant progress with co-producing the report. This must not be overlooked. The King's Fund have set the bar high and set a new standard for others to follow. I really hope that we've shown just how much patients and carers can actually achieve working on such complex and ambitious ideas to make an NHS that is truly joined up and fit for the 21st century. Thank you.
Dominic, thank you very much.